We have a dog here today, Sally, who was a rescue dog who unfortunately was not kept on year-round heartworm prevention. So she is positive for this disease and has these worms living in her heart. These worms are affecting Sally's overall activity level, how her heart pumps, and if left untreated can actually lead to her death. So what we're going to do today is treat her with a drug called imiticide. This has to be given in an injectable form, and she's getting an injection today as well as tomorrow. This injection has to go deep into her muscle and will cause these worms in her heart to die. As part of Sally's heartworm treatment, she has to be kept in a cage, very strict confinement, no activity where her heart rate would get really elevated for the next month. As well as this treatment is, to be quite honest, quite painful and uncomfortable for the pet. So this is one of the reasons as veterinarians we really push people to keep these dogs on year-round heartworm prevention. These dogs, treatment is no fun for them. It's painful, it's uncomfortable, and they don't understand why they have to be kept in a cage for 4 weeks. As well as this is very expensive to treat. These vials of medication are expensive and they're dosed on weight, as well as right now they're actually on back order, so we're having to import them from Europe to treat pets. So with all of this combined, we can have thousands of dollars as far as treating heartworm disease when your pet is already infected versus, we're talking less than $20 a month to prevent your pet from getting this horrible disease. So this is Sally. She is unfortunately our patient who contracted heartworm disease before she was brought into rescue. And this is Sally's mom, Kelly, who actually is one of my technicians. She's going to be assisting today. What we need to do with Sally is we're going to give this injection deep in her muscles along her back. And it has to go in a very specific location. The needle that we use is quite long because it has to go deep into her muscle tissue. Sally's a super nice dog, but again, because this can be a very uncomfortable procedure for them, for safety reasons, we always muzzle our patients when we give this kind of injection because, again, it's incredibly painful. Now, Sally's been pre-treated with some medications to help with her pain and help with her discomfort, but ultimately there's nothing I can do to completely eliminate that from her. Okay, so what we do is we have to give this injection in a specific spot. So we count down her vertebra, 2, 3, 4. We're going to give it right here. Okay, Sally girl. Good girl. So Sally just received her first dose of heartworm treatment. She'll receive another injection on the other side of her back in 24 hours, and then Sally will be hospitalized here for 2 to 3 days so we can monitor her vital signs and make sure there's no reactions. Then we'll send Sally home with her parents for 4 weeks, where she'll need to be on strict exercise and cage restriction. So now that we've seen a dog who had to be treated for heartworm disease, just please remember that it's very important to keep your pets on a monthly preventative year-round. These preventatives are prescriptions, so they're not something that can be purchased over the counter. You need a prescription from your veterinarian for, and we need to heartworm test them prior to beginning treatment to make sure that they continue to be negative. If you have any questions or concerns about heartworm disease or preventions, we'd be happy to answer them here at Complete Care Animal Hospital. You can give us a call at 740-397-7146. Please remember that heartworm preventions are prescription products, so they cannot be purchased over the counter. And they are something you do need a prescription for your veterinarian from. And we do carry all the major preventions here in the hospital. Thanks so much.